actually the chair of cardiovascular diseases here at Houston Methodist Sugarland Hospital, and I am also the director of our chest pain center. And I'm in our physician organization where we have approximately 9 members. Contrast, as you know, is definitely harmful to the kidneys. And the way the pathophysiology presents itself is that the contrast can lead to a transient reduction in renal blood flow. The iodine is also cytotoxic to renal tubular cells. It leads to the attack of adjacent cells by free radicals and results in an increase in the serum creatinine. So, contrast basically damages the tubular lumina of the kidneys and results in AKI through that mechanism. Contrast definitely increases the risk of dialysis. There is a higher risk of heart disease. Acute kidney injury increases the risk of in-hospital mortality, which leads to longer hospitalizations, 30-day readmissions, and progression of chronic kidney disease. This slide here looks at how acute kidney injury increases readmissions in patients with chronic kidney disease. So at 30 days, you can see approximately a 50% relative increase in readmissions. Over 90 days, it's approximately a 28% relative increase in admissions. AKI also increases mortality in our patients with chronic kidney disease. So there's a 167% relative increase in in-hospital mortality at 30 days and 117% relative increase in in-hospital mortality at 90 days based on this current study. There are no known treatments for acute kidney injury. The only solution is to try to prevent it from happening in the first place. And we're going to go over various strategies which will help you with that. Contrast volume does matter. So this slide looks at the ratio of contrast volume to the creatinine clearance. And as you can see, as you move to the right of this graph, as that ratio increases, the incidence of contrast-induced nephropathy increases incrementally. So definitely trying to keep that contrast volume to a minimum will help prevent contrast-induced acute kidney injury. This slide here also just reiterates the previous slide, looking at the GERM ratio, the contrast volume to the creatinine clearance, and just further illustrates that the more contrast you use, the more likely acute kidney injury is to occur. So reducing contrast delivered to patients prevents acute kidney injury. So the divert system is the only FDA-cleared, clinically proven technology to reduce dye or contrast delivered to patients during angiographic procedures. There's no compromise in image quality. It allows for real-time contrast monitoring and precise measurement of total contrast dose delivered to the patient. And it allows you to customize maximal allowable doses by individual patient. Now, I find that many of our patients really like the divert because it really provides some objectivity to what we're doing in the Cath Lab. So, in the absence of the divert, we don't always have a printout or absolute data regarding the volume of contrast that we should be giving, and also the exact limits, and also what we have given. So for some of our patients with chronic kidney disease, they are very in tune to the potential harmful effects of contrast. So many of them are very reassured when we use the divert, and we're able to tell them beforehand that we have certain thresholds of contrast that we plan to use, and we can demonstrate that to them following the procedure. So the divert has resulted in a 40% average dye reduction delivered to the patient and a demonstrated AKI reduction. Okay, the divert system integrates into a standard procedure manifold, and we're going to see a video on this shortly. Minimal time to set up, no change in standard injection procedures, and it's a single-use system. And I use this on all of my patients. And again, it can be You can customize contrast delivery to kidney function. So, based on a person's threshold for the contrast use, you can adjust the divert to accommodate for that. Right. So AKI prevention strategies proven successful in real-world hospital settings. So you can see this slide illustrates that at various institutions, there have been a significant reduction in AKI using these strategies. Our hospital saw a 35% overall reduction in AKI.